everyone, we are Team 7 and we decided to focus around the topic of the use of lean in quality improvement to reduce wait times in the emergency room. To begin, we will start with a brief overview of our presentation. In this presentation, we will be looking into what lean is. We will also be looking into why the topic of reducing wait times in hospitals is important. Furthermore, we will be looking at 4 different research studies to determine the effects of lean in hospital settings to reduce wait times. And finally, we will conclude the presentation by determining if lean in hospital settings is an effective way to reduce hospital wait times. Now we are going to look at what lean is in quality improvement. What is lean? Lean is a process of quality improvement that focuses on reducing waste and adding customer-defined value to services and products. Waste in companies can be any sector that is wasteful, such as unnecessary transportation, overproduction, defects, extra processing, etc. The lean thinking came from the Toyota Motor Corporation around 50 years ago. It is intended for practice-level changes and techniques that are used to standardize workflow procedures to achieve short-term goals. In this presentation, we will be using lean as a quality improvement method to reduce wait times in hospitals, which can be defined as a waste area. Why implement lean? With all of the budget cuts and the current economy, companies are looking to do more with less. This is where lean can come into play. Lean will identify and eliminate waste in company processes, which can lower cost and increase margins. How to implement lean in quality improvement? To implement lean in a workplace, there must be full support by the management to ensure that the proper resources and ongoing support will be continuous. There also needs to be proper training for all staff members to make sure they are fully aware on all lean methodologies and tools. To begin the program, workplaces must first look at current processes so they can determine where waste is and reduce or eliminate it. This is usually done through a value stream map that depicts all of the materials, parts, and process flows through the organization. After this is done, companies can conduct a root cause analysis to determine the cause of waste and how to get rid of them. By adding lean quality improvement to companies, money, time, and energy will be saved. Now we will look at the importance of the topic of reducing emergency room wait times. Roughly 14 million Canadians visit the emergency department every year, resulting in 1 million being hospitalized. It is critical for Canada to improve their wait times due to many factors. One factor is that long wait times in the ER have become a barrier for time and emergency care for patients. Another factor is that overcrowded ERs with large delays have been correlated with greater risk of mortality for admitted patients, death, and readmission for discharged patients. It is significant to improve wait times in the emergency rooms due to unsatisfying experience that most Canadians go through, which may prevent them from using these services in the future. To continue to stress the importance of lean, 40% of Canadians rely heavily on emergency rooms and its care when compared to other nations such as the United States, where only 34% of Americans rely on the emergency room. Across the province, in 2010, there were roughly 826,000 procedures that patients were waiting to get done, and only 9% of the patients were on a waiting list due to requesting a delay or postponement. Surveys were put out to find out what patients thought about wait times. Around 29% of patients stated that their wait times for specialized services were unacceptable, and roughly 72% of patients experienced some sort of distress such as anxiety and feeling worried. Lastly, 37% of patients' families experienced stress and worry that the individual became dependent on family or friends. By implementing lean into hospital ER wait times, it will reduce wait times as well as improve patient satisfaction and demonstrate the ability to improve wait times in other hospital services. In this presentation, we will be looking into 4 different research articles to understand the implications of implementing lean in quality improvement to reduce ER wait times. The first research article we will be looking at is Evaluation of an Emergency Department Lean Process Improvement Program. Longer wait times have been associated with greater chances of having adverse outcomes for patients such as mortality. Lean was chosen to decrease wait times in Ontario and improve patient flow. The first step that must be completed is to increase manufacturing efficiency in the hospital. In 2008, strategies on how to reduce wait times were discussed, such as public reporting of emergency department wait times, ways to decrease ambulance offload delays, and improving access in the community. Before any implementations began, a workflow diagram was produced to ensure that they were able to compare before and after, and also notice anything that needed to be improved. When implementations began to be introduced, 3 things were observed throughout this time: the sustainability and effects of emergency departments, reducing wait times, and the time it took to perform physician assessments 6 months after the implementation period. In Ontario, 89 emergency departments took part in this study, who were all chosen to participate by the Ministry of Health and Long-Term Care. The study took place over 4 years. All staff members, including physicians, nurses, and cleaning staff, were a part of reducing wait times from arrival to discharge. The transition took place over 7 months, where each emergency department was given an individual who was to coach staff on how to implement Lean into reducing wait times and how to track the changes. Emergency department wait times were measured from the time the patient registered with the triage nurse to the time they were looked at by a physician. The information that was collected about the patients was the day they arrived, the age and sex, and the Canadian Triage and Acuity Scale. The scale allowed the nurses to give the patient a number based off how severely they needed medical attention. The study proved that there were improvements in reducing the length of stay in patients and minimizing the time to initial physician assessment. To ensure that these changes are permanent, each staff member must feel confident with the changes and must be trained with the new Lean protocols. For Lean to be effective and not just temporarily fix a problem, it must look at the overall picture, not just the wait time. By decreasing the overall length of time patients stay, it will free up beds for the next patient, improving physician efficiency, and being organized will allow the physician to see more patients in a short amount of time. If the hospital continued to allow more people to see a physician quicker, but did not improve the overall system, they could not accommodate for this. This would create bottlenecking in the hospital. This entire process needs to be a continuous improvement. The process needs to be reevaluated every month to see if any additional improvements should be made and to ensure that all staff are continuing to follow the protocol and not reverting back to old habits. Now we move on to our next study, applying Lean principles of the Toyota production system to reduce wait times in the emergency department. Given the intense public and media focus emergency department wait times have had in recent years, hospitals countrywide have implemented an assortment of solutions with varying success. Hotel Dieu Grace Hospital in Windsor, Ontario, is a regional trauma center that serves a population of over 450,000 with approximately 55,000 annual ER visits in 2005. In order to decrease wait times and meet Canadian Emergency Department triage and acuity scale wait time targets, the hospital implemented numerous strategies including increasing the number of triage nurses and stations, adding medical directives, increasing physician staffing, and hiring a nurse practitioner with a fast-track area. However, these efforts had little impact on overall emergency department wait times. As such, in September of 2005, the emergency department began a makeover of departmental processes utilizing lean manufacturing processes developed at the Toyota Motor Corporation. The hospital first noted that while there were many factors contributing to suboptimal wait times that were beyond direct control of the emergency department, such as inpatient capacity, there were departmental factors that could be changed to improve both efficiency and patient satisfaction. The project focused on dischargeable patient group, which represented 85% of ER patients, with the scope of the project involving improving interdepartmental flow of patients. The project began with a scoping exercise mediated by a lean consultant. It was determined the focus would be on patient at initial triage and would exclude primary psychiatric complaints. Those who participated in this initial step include emergency physicians, nurses, clerks, cleaning staff, representatives from diagnostic image and respiratory therapy, in addition to numerous members of administration, among others. This group then completed a 3-day value stream mapping Kaizen workshop. The first day focused on the creation of a current state map. The second day involved creating a future state map of ideal emergency department processes, and the third day outlined various improvement projects to reach the ideal processes. To this end, 3 general project priorities were identified. workplace organization to improve the layout of the emergency department, creation of standard work that every worker was expected to do consistently, and communication of lean concepts and projects to the emergency department staff. In order to implement and sustain these projects, the emergency department leadership team created a lean education and project board which acted to organize staff and information sessions and recruit frontline staff to be project leaders. New projects were created and implemented weekly based off of staff feedback and suggestions. In the months following the lean workshops, there were significant reductions in wait times and length of stay. Prior to implementation, the mean wait time to see a physician was 111 minutes, and the mean length of stay for discharged patients was 3.6 hours. From April of 2006 to March of 2007, average wait times were down to 78 minutes, and the mean length of stay was 2.8 hours. In the same time period, patients who left the ER prior to being seen fell from 7.1% to 4.3%. Additionally, patient satisfaction scores improved and were more consistent post-lean introduction, an increase from average monthly scores of 79.8% in 2005 to 83.1% in 2006. The substantial improvement seen in the emergency department can be attributed to the wide array of lean initiatives implemented to achieve the future state value stream map. Moving on to study number 3. How does lean work in emergency care? A case study of a lean-inspired intervention at the Astrid Lindgren Hospital, Stockholm, Sweden. The emergency unit consists of 2 sets of patient flows, pediatric and surgical orthopedic. This study included a qualitative and quantitative analysis of the ER. To examine quantitative, the study looked at the before and after of wait times. For the qualitative research, the study included components such as the lean intervention and collect data that viewed how the intervention worked based off of the 4 principles of lean. The 4 types of lean principles are defined as standardize work and reduce uncertainty, bridge individuals together who are dependent on one another, create seamless uninterrupted movement of work through the process, and lastly, authorize staff to investigate process problems and to develop, test, and apply countermeasures using a scientific method. During data collection, workflow was closely evaluated. For example, information flow and roles of each member in the department were monitored to analyze the difference between before and after intervention. The quantitative data was collected for 52 weeks prior to any changes being made. After decisions were made on what protocols to implement, more data was collected for an additional 52 weeks. The results displayed 3 categories such as the quantitative data analysis, the case description, and the improvement process. The significant performance outcomes that were found in the study was the percentage of patients completing their visits increased from 67% to 80% after implementation of lean method. Also, the average wait time for physicians decreased from 67 minutes to 51 minutes. The volume of patients also increased from 24.4 to 26.6 visits per day. After reviewing the results, the hospital found that there was a significant wait time reduction that was achieved. Throughout the lean process, there was seamless communication and coordination that improved healthcare by reducing wait times and improving the overall quality of care. Finally, we're going to look at our last study on this topic that helps to conclude the need for lean implementation in emergency departments. This study is simulation-based verification of lean improvement for emergency room process. The emergency room and staff were able to address some of the wastes in the room, such as transportation, patients walked to room or bed, waiting times to see professional or service, and over-processing, registration and paperwork done by nurses. Also, reduce the amount of work by dividing up the work between nurses. Thus allows flexibility and allows them to support the registration desk. The team was able to use lean thinking as a way to develop a better state of process, identify and bridge any gaps, and prioritize any activities. This can allow a better understanding of the overall process and improve visual management for current processes. Now we will conclude our presentation. From the research we observed, we can confirm that lean is an effective way of reducing wait times in hospital emergency rooms, which can decrease the risk of adverse effects for patients. Overall, lean would be a good methodology to implement in all hospitals to help reduce wait times and identify any other areas that waste can be eliminated. Thank you for listening to our presentation. We hope you learned something.